pretty much thrown the entire kitchen sink at me. And nothing seemed to move the needle. Every year, my blood pressure very slowly got a little bit worse.
After the stroke, we actually increased to 3 times a week. And that was over a period of 6 weeks. And ever since we actually ramped it up that high, we found that your blood pressure normalized.
It did. Yeah, it's consistently 120/80. I was doing well. My body comp is great. A lot of parts of my cardiovascular health are really exceptional. My strength is great. My hormones are managed. Try to sleep 9 hours a night. My gut health and my detoxification pathways and my diet. And because I do a lot of orthopedic work, my movement is good. My mental well-being is on an upswing. So all those things that could have a negative impact on that were sort of removed. I'm Todd Vande, CEO of Stark, and I've gone from vegan to paleo to keto to carnivore, from cryosaunas to ice baths, to training like an athlete, to being injured like one, enhancing my mobility and optimizing my sex hormones with thousands of labs and various forms of scans. I'm surrounded by high-level medical doctors, naturopathic doctors, chiropractors, nutritionists, and strength coaches, all leading me in concert to a state of optimal health. And I'm here to share that journey with you regardless of your age, your genes, or your medical conditions. Today, my guest is Dr. Alice Nguyen, the head clinician here at Stark, and we're going to dig into one of the most fascinating topics, in my opinion, in cardiovascular health, phosphatidylcholine, in particular through IV therapies like Plaquex and the outcomes that we're seeing in patients. And the reason I think this is so fascinating is because I've been on this health journey, as you know, for 15 years, and we've done so many things for my cardiovascular health, and we just haven't been able to correct the old issues that I've created over the years well enough. And then added this therapy and boom, my blood pressure plummeted. We believe my arteries are becoming more clear. And in general, we have reversed my cardiovascular age. Absolutely fascinating. Hope you enjoy the show. Okay, we're going to talk about PTC IVs, which I'm a fanboy. I guess you can describe me best with that. I've had such great experiences with it, but I don't really fully understand it, and I think a lot of people don't. I'd love to get some more technical science information out there so people can really understand what the mechanism is in changing so many aspects of cardiovascular health. So tell me, how does phosphatidylcholine, especially the Plaquex therapy itself, how does that work, and what's going on the cellular and vascular level, and how does it support cardiovascular health?
Phosphatidylcholine is a crucial component of cell membrane. And if...
I mean, it's like an ingredient of the cell membrane?
It makes up the cell membrane. If you read the book Biology Belief,
I love that book.
So they talk about how the cell membranes are actually truly the brain of the cell, not the nucleus. So if the cell membrane doesn't work appropriately, then nothing really works in the cell correctly. So, but when it comes to, well, first of all, so phosphatidylcholine. Choline is a component that is actually found in kind of many sources. Now, in the Plaquex IV, it's actually a purified form of it derived from soy. So for patients...
From soy?
Yeah.
Really? So it's like a vegan diet for your cells?
Yeah. It's the choline component.
Okay.
That's the choline is actually found in eggs.
Mm-hmm. Okay.
It's also found in liver. Now,
in eggs, specifically in the yolk? Okay.
In particular. Now, if you cook the egg yolk, so you scramble it, or if you hard boil it, where it's just completely like the goo is kind of cooked out, you actually degrade the choline. So the best way to really kind of consume choline is, in fact, making sure that it's a poached egg or sunny side up.
Mm-hmm.
In liver sources, that's actually found in liver, but most people will not eat it.
Choline is found in liver?
Yep.
I didn't know that.
Sources of choline as well.
We need to eat our liver.
Yeah, we do. We have a lot of it.
Okay.
So now you can also find choline in sunflower. So sunflower lecithin, soy lecithin. All of those are actually components that will contain choline.
Soy lecithin, is that the ingredient that prevents dark chocolate from becoming all gooey?
Yeah, you can actually see that in that too. Yeah,
okay, so that's an ingredient, right?
It's an ingredient to use to kind of emulsify the chocolate.
I always thought that was an ingredient to avoid.
Not necessarily.
Okay.
Yeah, it really kind of depends. So for a lot of liver health and the production of bile, especially if someone has really thick, sticky, sluggish bile, lecithin is in fact one of those supplements that you would have patients take to really kind of support the health of bile production.
How would you know if somebody has that sludgy, thick bile?
You can basically see this in imaging.
Oh, what kind of imaging?
Liver ultrasound.
Oh, okay.
Upper right quadrant up ultrasound, you'll actually see if there are stones or sludge in the gallbladder itself. If you were to just look at labs, then you would see like an elevated GGT liver enzyme potentially. Perhaps like elevated alkaline phosphatase too. But that's usually if there's some sort of a blockage, some sort of a gallbladder issue obstruction.
Any other way outside of the PTC IVs that you've done that you've seen such dramatic results theoretically leading to better cardiovascular health? Any other lifestyle or other foods or other things that you can do to achieve a similar outcome?
Well, just not depleting or choline, especially if you're not eating a lot of it anyway. So if a person is drinking an excessive amount of alcohol,
that depletes choline?
Well, it's if you don't have enough choline in place and you drink a lot of alcohol, which taxes the liver, and you don't have the choline, which then doesn't make the bile as efficiently. So that's going to be a problem. Now, Plaquex is actually used for non-alcoholic fatty liver. So it's a liver support IV as well. We can see some reduction in LDL cholesterol and triglycerides. Although, again, if the patient's continually eating badly and not eating a lot of fiber, and then you're going to see not much movement in the lipids.
Interesting. Do you also see a decrease in visceral adipose tissue with this particular therapy? Have you seen that connection?
We haven't seen that yet. No,
okay.
No. And again, you can have all these IVs all day long, but if you continue to eat like a...
asshole.
Yeah, a-hole.
Yeah. You just won't get there.
You're going to still have this adipose tissue.
Mm-hmm.
But what the important thing about phosphatidylcholine is if it supports the cell membrane, what's really important in your cardiovascular system is that endothelium, so that inner lining of the blood vessels. And the Plaquex IV has been shown to be really effective at least supporting the endothelium.
Supporting it, meaning like making it smoother again, or?
No, not necessarily. There are integrative cardiology and, naturopathic or functional medicine clinics who will use it to help with the possible regression of plaque in the cardiovascular system. So as a monotherapy, as a single therapy, there hasn't been any studies to really kind of support that, not that I have seen. So usually it's used in adjunct with, of course, like either a pharmaceutical, obviously lifestyle interventions, other,
So you use a pharmaceutical with it generally, or what kind of pharmaceuticals?
So any lipid-lowering, agents. So things like ezetimibe, statins, PCSK9 inhibitors, like
And you're using all those things with various patients?
Yeah, for us, we are utilizing it. It depends on what the patients want to do. So it's to show decision-making. We do have patients who refuse statins or refuse pharmaceuticals and want to utilize nutrients as well as lifestyle intervention to address, abnormal findings in either their clearly CCTA or their CIMTs.
Mm-hmm. And this would be one of those therapies.
Yes, absolutely.
Because you're sort of you're not really getting to the root cause. The root cause is lifestyle and nutrition.
Yeah.
But you're correcting the negative impacts of lifestyle and nutrition. So you're just like above those root causes, kind of course correcting that. And then at the same time, when you change someone's lifestyle and nutrition and add exercise and things of that nature, sunshine, optimal hormones, then you can start to see this global impact on cardiovascular health. Is that kind of what you've been seeing as a clinician?
Yeah. One of the shocking, I didn't expect this. I didn't really expect this at all. Usually we would advocate for a series of the Plaquex IVs, probably between 10 to 40, depending on how bad their images come back.
10 to 40, what is that?
IVs.
Oh, wow. 10 to 40 IVs. Okay. Over what period of time?
This can be over like several months, obviously.
Okay.
So, if the patient is if there's an acute situation. So if someone, for example, suffered stroke, and we're utilizing it to actually heal the brain, So there's a neurological implication or indication for Plaquex IVs.
Is it have a neurological implication because of more oxygen delivery, or what?
Yeah.
What's
Well, anything that improves the cardiovascular system and the blood vessel health will actually improve brain function.
okay?
But
Makes sense.
the phosphatidylcholine itself, so choline is a precursor to acetylcholine.
Okay.
That's a neurotransmitter that's important for memory,
Oh.
for mood.
Okay.
So now it's also antioxidant. It's anti-inflammatory. So after something like a stroke, there's a lot of inflammation and oxidation that's happening, and the phosphatidylcholine
Because of the trauma of the whole thing. Yeah.
absolutely, yeah.
Okay, and so it enables you to develop more acetylcholine. Is that what you said? That neurotransmitter, and that is like the beginning stages of rebuilding the brain. Is that kind of
And remember, cell membrane.
the cell membrane?
Yeah.
Yeah. The key one of the key components of the cell membrane.
What's interesting is one of the recommendations for newborn babies, whenever they can start eating again, it's encouraged that they actually should have eggs. They should have egg yolk. So
When they can start eating again, you mean
not eating again, but when they actually can start eating.
Like real food. Yeah, not just breastfeeding, but real food. Yeah. Yeah, that makes sense.
It's important for their brain development.
It's a key nutrient.
Yeah.
Right? Has a similar impact on older people to sort of recreate the shape of the cell membrane. Is that kind of the idea?
Acetylcholine is the one thing in the neurotransmitter that is really crucial for memory and mood. So as we get older, depending on the diet, if you think about it, are people eating effects? I know you don't eat eggs. I know you don't eat liver on a regular basis. So do you have enough choline in your system?
Good question. You just start ramping up the liver in my diet. Well, a lot of people can't handle eggs, like I can't handle eggs. Is that a concern? And are there certain foods that you'd recommend people eat more of if they can't eat eggs?
Liver.
Just those two things.
Yeah,
those two. There's not more?
High sources of it.
Okay.
And supplementation.
And what kind of supplementation?
Less than just straight up phosphatidylcholine. But compared to an IV, you're going to have to take Herculean amounts of phosphatidylcholine oral supplements to actually even equate the IV.
Okay. And it's sort of like a situation where you've got to do damage control, like take a car that just got in a bad accident and put it through a body shop. Like you got to sort of recreate the original shape of those cell membranes. Is that kind of what has to happen, like with the aggressive nature of doing an IV versus trying to get it from food?
Again, it really depends on how bad the patient is. So we'll take a look at their imaging, like their CIMT, their CCTA, clearly.
Yeah. And so outside of diet and alcohol, so we've got sugar, the food they're eating, the alcohol they're drinking, what are some other things that are creating these damaged cell walls and depleting it?
First of all, most patients are just deficient in omega-3s.
Omega-3s, okay.
So they have more omega-6s versus omega-3s. And omega-6s, if it's in excess, will actually it's pro-inflammatory. They don't have an omega-3s to really kind of balance out that oxidative stress.
And that's a simple blood test, right?
Simple blood test. Yeah.
It's a ratio, omega-3s to omega-6s? Is that what you're looking at?
We typically look at the omega-3 index. So how much omega-3s are actually in the cell membrane itself too. Obviously, if there's any trauma,
trauma like physical trauma or emotional trauma?
This could be a traumatic brain injury if we're looking at the brain. This could be a stroke, yet again. And this could be also chemical insults. We are very exposed to a lot of toxicants out there that can actually damage the cell membrane.
Like in the air and the food,
metals.
The things we drink. Oh, metals. Okay, so fish.
Everything. Like I've actually heard case studies where patients do not eat any sort of fish whatsoever, and they still have high levels of mercury. It's actually in the air.
Oh, that's scary.
Yeah. So unfortunately, if you live close to a coal burning facility, they will liberate a lot of mercury into the air. And when patients are, kind of living and breathing that, they will take it in. So that's a big concern.
And what parts of the country in the U.S. have issues with that?
Well, I believe some parts of the East Coast will still have some coal burning facilities.
Okay.
But it's actually in the Pacific Northwest, apparently.
Really?
It's not the coal burning facilities there. It's unfortunately all the coal that's being burned in China.
Really? That's just making its way across the Pacific?
Yep.
Oh, that's crazy. And what about like volcanic activity and things like that? Is that also caused?
But they do suspect that it's actually mostly coming from coal, the burning of coal. A lot of the mercury is actually stored in coal. When you burn it, it liberates into the air.
Wow.
Whenever if you have any of those thermometers And I don't know if you ever taken like a chem lab before, chemistry lab.
Sure. Yeah, didn't really work that hard at it. Chemistry wasn't my thing. Yeah. It would be now, but I was just too immature for it.
In lab, if you ever broke a thermometer, they would evacuate the room. They would go in with a hazmat suit. They would have like a special kit to actually collect that early. It's that toxic. It's a powerful neurotoxic. So, but it's not just toxic to the nervous system. It's to every cell in the body. It could be the heart. It could be the cardiovascular system. So there are a special class of doctors who really kind of focus on environmental toxins. And one of the suspected causes of heart attacks, strokes, high blood pressure, interestingly enough, are metals. Wow. They get in the way of the receptors working appropriately. So this was something that I've learned from my mentors.
Wow, so interesting.
Now, going back, one of the surprising side effects that we've seen with the Plaquex IVs is we've seen decreases in blood pressure.
Decreases in blood pressure.
So patients who've had this elevated blood pressure for a long period of time, not really well controlled with meds, or just they're not on meds, they don't want to be on meds. And we do a series of the Plaquex IVs, and we find that their blood pressure normalizes. And the reason why is, first of all, the receptors.
Is this a theoretical reason why, or are you certain at this stage?
I've talked to my mentors about this. I've brought this up. And one explanation is that the receptors are working better. Cell membrane.
Makes sense, yeah.
The other is that when it comes to the endothelium, remember the blood, the inner linings of those blood vessels, if you repair them, then they function better. So they're not, their ability to really kind of vasodilate and constrict is actually more effective, more efficient.
And so the likelihood is a combination of both of those, right?
Yeah. And it is actually helping with the regression of some of the atherosclerotic plaque. Then you're getting better kind of movement with the blood vessel.
That makes a lot of sense. And there's no real way at this stage to tell exactly which it's affecting. We just know what the outcome is, right? We just know that the blood pressure markers have changed substantially with patients.
I went to an integrative cardiology conference about 4 months ago. And there was an integrative interventional cardiologist who was there and spoke of the Plaquex IVs, him utilizing it. I did ask him if he has ever seen the Plaquex IV cause full regression of plaque, or, as a monotherapy, as a singular therapy.
I mean, nothing else changes, no diets change, no exercise.
Using any sort of medications or anything like that. So for him, he said he hasn't seen it. He hasn't tried it.
Okay. So, because he's doing like a potpourri of solutions.
He's really throwing the kitchen sink.
Okay.
So he's doing like mold testing, he's doing metal testing, he's doing like a therapeutic plasma exchange. So in the integrated setting, it's very hard to see what's really it's the one thing that's actually working, because there's multiple things that's actually being implemented. I will say that we do have there are some people who refuse pharmaceuticals. So we do have one patient in particular that we're following right now, where he had a pretty concerning CIMT ultrasound. And he refuses the statins. He refuses any pharmaceuticals. He says, I will do the IV. I will take red yeast rice. I will take the fiber. I'm going to lose weight. I'm going to lose body fat. I'm on testosterone. So we're going to see what that looks like. So I believe we have a follow-up scan on him.
Okay. And that's a lot. I mean, that's a lot of change. So depending on where he's starting, it may provide massive outcomes, right?
Yeah.
Massive changes.
It could, yeah. So, but it's hard because we're actually getting him to train, he's losing weight, he's losing body fat. So it's probably all synergistic.
We've seen substantial changes in my own blood pressure, right?
Yeah.
This is really interesting for me, because pretty much thrown the entire kitchen sink at me, and nothing seemed to move the needle. Every year, my blood pressure very slowly got a little bit worse.
I wouldn't say it got worse. A lot of it was stress related for sure. There was always a very interesting difference in your systolic actually being much higher than your diastolic. So you always had like a 130, 140 versus like over a 60 or 70.
Yeah.
So that pulse pressure was actually something that was really, really interesting. And again, usually indicative of potentially atherosclerosis. Then you had your event, your stroke. And one of the things that we did after consulting with Dr. Paul Anderson was we ramped up your Plaquex IVs. So we started to implement it. You were only getting it once a week.
Mm-hmm.
After the stroke, we actually increased it 3 times a week. And that was over a period of 6 weeks. And ever since we actually ramped it up that high, we found that your blood pressure normalized.
It did. Yeah. It's consistently 120 over 80. It's crazy. It's just completely normal. It's perfect.
And your stress is not any less.
No, my stress is probably even higher. So it's really quite fascinating that actually had an impact like that, especially for me, right? Because there's so many things that I was doing well. My body comp is great. A lot of parts of my cardiovascular health are really exceptional. My strength is great. My hormones are managed. Try to sleep 9 hours a night. My gut health and my detoxification pathways and my diet. And because I do a lot of orthopedic work, my movement is good. My mental well-being is on an upswing. So all those things that could have a negative impact on that were sort of removed, but I continued to struggle. And this one therapy got dropped in and boom, normal. And it was pretty quick too, wasn't it? Maybe 3 or 4 months in. And all of a sudden it's kind of ticked down.
It's actually more like 2. We were monitoring your blood pressure very carefully. It was more like 6 weeks.
6 weeks. Wow.
Yeah.
That's quite remarkable. And you believe it's that single additional therapy that put me over the top?
Yeah, I do think so. And you're not the only one. So we've come across a handful of other patients who started their Plaquex series, and they're not doing it like 3 times a week. They're doing it like once a week.
Got it.
And their blood pressure has dropped, and it was really, really interesting. So again, we have a lot of these case studies. I hope to publish on this eventually, so that more people are actually kind of like monitoring it. We have so much data on our patients. So we have their DEXAs, we have all of their advanced labs, and also imaging, and just kind of tracking them over time.
Very cool stuff. So amazing. I think it's very exciting. It's exciting because if you're doing, this is what I love about it so much. If you're doing all the things necessary to have exceptional cardiovascular health, and that stop and sort of pause the aging process, and maybe can't completely reverse some of them. Some of them get reversed, but maybe not all of it. This sort of takes things to the hoop, and doesn't seem like a permanent therapy. It seems like if you can reverse the aging process through this PTCIV, and you're changing all of the natural methods at the same time, you can essentially turn back the clock in your cardiovascular age and maintain it. Is that right?
That's the hope. That's the goal.
That's the hope. It seems to be working so far. Thank you so much for sharing this with me and all of our guests. I think it's such a fascinating new tool, and it's not something that most cardiologists would agree works this way, right? Wouldn't they argue that you can't clear things like soft plaque?
It really kind of depends on how advanced the disease process is. So if they're like a stage 1, stage 2, maybe there is some potential for regression, and they'll use lipid-lowering agents to actually do that instead.
Okay.
Attempt to do that.
Okay.
However, here's the thing is that these statins, while they reduce cholesterol, what they actually do is that they stabilize the plaque by calcifying it. So that's and of course there's like this discussion that the statins.
So it remains in there, sort of, right?
Well, yeah, it's you don't want that plaque to actually be soft like cheese, because if it ruptures, then it can actually cause an issue. That's the problem. However, if you go for a long period of time and having all of that plaque basically calcified, then you run the risk of basically narrowing that vessel. But that's actually not how most cardiovascular events actually occur. Okay. Now, unfortunately, again, if it just keeps going, then you might have to, go in, start having symptoms like, chest pain, shortness of breath, or any of those things. And there is a 70% occlusion, then, especially if it's calcified, potentially you have to go in and get a stent.
Yeah.
And we actually do know people who've been on a statin, been on ezetimibe, been on multiple medications to lower their lipids, and they still have an event, and they still have to go in, and they still need a stent.
They have an event with low lipids, right?
We've seen that as well. Mm-hmm. I will say that there was a study that was published probably half a year, 6 months ago, back in February, I want to say, looking at lean mass hyperresponders. and utilizing Clearly to really kind of assess whether or not these patients will actually have an increased risk of, plaque formation or progression. And it's not as clear. So that's something where, they think it's a completely causal sort of situation. And that study showed that that's not necessarily the case. And that's actually what we're seeing here too, is that, I have this one patient who's had low cholesterol ever since I've known him. He finally got a CCTA with contrast. We're going to run it through the Clearly.
For our guests, Clearly is the AI overlaid software that
with the CCTA with contrast.
Creates these amazing 3D images that a cardiologist can slice and dice and kind of look around and see inside your heart.
Yeah, we can see around the vessels, can turn it around.
It's fascinating.
Also quantify how much soft plaque, how much calcified plaque is there, and then track it over time. I think it's a great tool, but, we have seen a mixed bag of things here. So, I will say that I don't rely 100% on lipids or just the blood panel anymore. And what we do see is that patients who have high percent body fat, they're at actually a higher risk. So we'll track that. And if we have a patient who doesn't have that problem, then we'll actually implement the lipid-lowering medications. So there's a time and a place. I will just say that it's a case-by-case N=1 situation for our patients here.
Thank you so much for joining us. If you all like today's podcast, please don't forget to like and subscribe. And if you want to learn more about Stark, you can find us at stark.health. That's stark.health.